Cystic fibrosis, in layman's terms, I think is probably best described as a genetic disorder that affects your entire body. One of the main things that we see, though, with our children with cystic fibrosis is the lung involvement that they have. And by that, I just mean that they have a large amount of secretions and mucus that is in their lungs, and it gets really sticky and thick and leads to repetitive episodes of lung infections. One of the other big problems that they have is belly related, and they don't absorb their food very well, and so they have a lot of difficulty growing. Cystic fibrosis is not something that is contagious, nor is it something that you can catch. Cystic fibrosis is something that you're born with. It is a genetic condition. Cystic fibrosis affects the daily lives of children and their family to a very significant degree. We ask of them to do a tremendous amount of medications and different therapies to help them with their lung disease and with their overall belly problems that they have. It adds literally hours to the day of treatments and medications and therapies that they need to do to live a happy and healthy life. There are a variety of different treatments that we do for cystic fibrosis. To think about their lungs first, one of the big things that we have them do are inhaled medications of multiple different kinds, but they will take nebulizer treatments and do that multiple times a day. One of the other mainstays of therapy is related to their airway clearance, and by airway clearance they have difficulty with the thick secretions in their lungs, so airway clearance is the things that we do to help them get their mucus up and get it out of the airway. So in addition to the breathing treatments that they do with nebulizers, one of the big things we do is vest therapy. So that's where they put on this mechanism that looks kind of like a life jacket that's hooked up to a machine that pumps in and air in and out very quickly, shakes them up and helps them to cough and clear out that thick amount of secretions that is within their airway. They have a lot of sinus-related disease, so a lot of sneezing, congestion, and really thick mucus in their nose. So there's a lot of different nose sprays and allergy medications that we will often do for them. The next big thing would be related to their belly. So they typically have a lot of difficulty with absorbing their food and a lot of nutritional problems. So one of the things that we do for them not only are very specific cystic fibrosis vitamin supplementation, but we help them with enzymes that they take to help replace their pancreas function. That helps them sort of break down their foods and absorb it so that they can grow. There are several different types of newborn screens that have been in place across the United States. In Oklahoma, I believe it was February 14th of 2005, we had newborn screening instituted in our state. So what it is a blood test. It's the same blood test where the little heel prick test is done on our babies to look for various genetic conditions. Cystic fibrosis was put into that panel in 2005.
So currently in Oklahoma, the newborn screening protocol is that we do an IRT assay. That's an immunoreactive trypsinogen. It's a protein or enzyme on that assay. If that is elevated above a certain cutoff, and it varies slightly depending on each run that they do, then they will automatically reflex to do DNA testing. The DNA testing currently includes 39 of the most common cystic fibrosis variants, and as well 4 mild variants as well. And the testing gets flagged as abnormal if there's an abnormal IRT with 1 or 2 genetic changes. So newborn screenings are done usually after 24 hours that a child is born, although sometimes it's done beforehand, so it may be repeated, and before they get discharged from the hospital. So almost all these newborn screenings are done while the baby is still in the hospital. The newborn screening results will usually come back within 3 days. They don't run it over the weekends, so give or take 3 to 5 days. If anything is abnormal, in particular for cystic fibrosis, then it may extend the turnaround time to about 7 to 10 days, and that's because of having to do the additional DNA testing, plus that will usually include a weekend, and so it usually delays things a few days. Typically, the parents will be told as soon as the results come back, so that's usually 7 to 10 days. By then, most babies are discharged from the hospital, so it'll typically be the pediatrician who is contacting the parents to give them those results. That may be done at a newborn follow-up appointment, or it may be done over the phone. But always then afterwards, the state will also mail a letter to the family letting them know that their baby needs a sweat testing just to confirm some newborn screen results.
After the initial blood tests are obtained from the newborn screening for cystic fibrosis, if there is a positive value or a value that is of concern, it is followed up with a sweat test. And a sweat test is a lab that is obtained by making a child sweat through a machine that is placed on, and we collect that sweat and send it to the laboratory. There are several tests that can be performed after the sweat test. However, if the sweat test is in a positive range, then the diagnosis is confirmed as cystic fibrosis.
So as a genetic counselor, I feel that my role in this whole process is really to kind of streamline things and be a navigator in a way for these patients. My role, where I come into it, is after they've been given the results, usually by their doctor, then I will see them for the sweat testing. And I do the genetic counseling kind of at the same time that we do the sweat testing. And so I sit down with them and discuss, these abnormal newborn screen results. This is kind of the goal of the newborn screening program, is to identify babies who have an abnormal screen result. And if they're abnormal, we want to make sure they get follow-up right away and get treated and things like that. But inevitably, with the newborn screening, we may find things that are not truly abnormal, that flagged as high or flagged as elevated, but the baby doesn't actually have that condition. So my role in this is to kind of navigate them through this process of that your child may not actually have cystic fibrosis, but we need to do this sweat testing to help clarify and confirm the results and get you to the right resources if so. So most babies who have an abnormal IRT, where the immunoreactive trypsinogen is elevated, don't actually have cystic fibrosis. Only the babies that have one or two genetic changes will need to get a sweat test. For those that have one genetic change, by far the majority of them will not have cystic fibrosis, do not have cystic fibrosis. But we don't want to miss anyone who does have cystic fibrosis. So the majority of individuals who end up having sweat testing actually do not have cystic fibrosis. And since the sweat testing is done kind of in conjunction with the genetic counseling, I have the opportunity to share that with the parents as I go over the newborn screen results. Your baby has an elevated IRT, however, they only have one genetic change. So that means we know they're a carrier, but they may not actually have cystic fibrosis. And so this test will help clarify that or not. And so I explain that, and I'll be honest, most parents are a lot calmer after discussing that with them, even before they get the results of the sweat testing. A lot of people assume that it's flagged as abnormal on newborn screening. That means my baby has the condition, and that's not the case. And so it gives them a lot of reassurance that most likely the baby won't have cystic fibrosis. If we get a newborn screening where the IRT is elevated and the baby has two CF genetic changes, we really have a diagnosis, and the sweat testing is just to confirm that. So the day that they are scheduled for a sweat test, any baby who flags abnormal, has an elevated IRT, and one or two cystic fibrosis genetic changes is recommended to have that newborn sweat test. On that day they have the sweat test. We do the sweat testing and genetic counseling at the same time. So by the end of the appointment, if we get enough sweat, then I will give them the results of the sweat testing. If they have a positive sweat test, they'll be given that result immediately. And we have contracted or kind of connected with the Cystic Fibrosis Clinic so that those patients will be referred immediately.
Before newborn screening was implemented, cystic fibrosis was mostly a clinical diagnosis, at least at first. There were children who were diagnosed immediately because of very bad GI-related problems that can happen at birth that require surgery. Those children who did not have something called meconium ileus, which is the GI problem, are diagnosed typically months later or even years later. The children that are diagnosed months later, in the first several months of life, are because of usually having a very significant amount of trouble with difficulty gaining weight and trouble absorbing their nutrients and a lot of GI related problems. Children can be diagnosed much later in life if they have had a relatively mild GI course and not much in the way of belly problems, but have had a chronic cough with repeated episodes of pneumonia and chronic bronchitis that has gone unrecognized by other physicians and other people, and we just don't see that it is cystic fibrosis until sometimes years later.
Eden was born on a Thursday, unexpectedly. It was March 28th, 2013. Her CF story actually begins quite a bit before birth because we found out during my 20-week ultrasound, the anatomy scan in November of 2012, that she already had an intestinal blockage that sometimes happens when kids have CF. So they did my blood work, and it turned out that I was a carrier, and then they did my husband's blood work and found out that he also was a carrier. So it was starting to look pretty clear clinically that Eden was very likely going to have cystic fibrosis. She wasn't diagnosed officially until she was about 2 weeks old. Our first contact with the CF pulmonology team was Dr. Dramer when Eden was admitted to the NICU for workup of that bowel obstruction that comes sometimes with CF. He came to see us, and we actually weren't there, and I thought it was really weird that a pulmonologist would come talk to us because at the time she just had a bowel obstruction and not a lung issue. But he came and saw us when she was a couple days old and started giving us the information about what to expect. And then several days later, Dr. Walter came, and I remember I was in the hall leaving the NICU to go to lunch, and he passed me in the opposite direction, and I said, "I bet you're coming to talk to me." And he said, "Yes, I am. Let's turn around." And by that time, I pretty much knew already that she had it. Knowing about Eden's cystic fibrosis from the time she was an infant has absolutely impacted everything. She had a little bit of trouble with gaining weight as a baby, but we were always changing her enzyme dose. They were seeing us, probably once a month in the clinic, checking on dosing for medications. There were things that I didn't realize being a new mom and that Eden was my first child, things that I thought were normal that were absolutely CF issues. We actually came to find out that medically speaking, at least in terms of Eden, everything that seemed even just like a normal childhood issue was always somehow related to CF. So we kind of really, really heavily and continue to heavily rely on the CF docs until they tell us, oh, you can actually go to your primary care doctor for that one. Her quality of life has been really quite awesome, I think. I'd like to be Eden some days. But being off to a good start, being able to avoid hospitalizations as much as possible. I mean, kids with CF used to live in the hospital, and she's had one hospital stay in the past 2 years almost. So she gets to live a pretty normal life because we were able to attack things so early and do a lot of preventative kinds of treatments. I certainly hope that being diagnosed with CF early will impact her life long term. People I know who are a little bit older, the generation that's closer to my age they're in sort of the winter of their lives, and kids with CF are so much healthier than the others were at that same age. And so I'm optimistic seeing how people my age some are still doing okay, and they didn't have the treatments that we have. Like, for example, Eden had a bronchoscopy done where they stick a camera down into her lungs and kind of survey the lay of the land and flush out any of the mucus in there. And they said, both of the doctors have told me on separate occasions that there was no evidence of cystic fibrosis in her lungs alone. So that's pretty awesome. Early diagnosis will definitely make her life easier. In some ways, it will make my life easier because hopefully less hospital stays, less antibiotics. In some ways, it makes my life harder because I wasn't able to enjoy the infancy very much when I just looked at her and saw this poor sick baby. And now that she's older, she's fine. I mean, she looks fine. But we had to start really aggressive treatment routines when she was a baby, before she had problems. Like I said, that will be helpful to her, but made my life a lot harder for a little while. We never got a grace period of not having to do treatment. I hope that through the newborn screening, through early diagnosis, she'll be able to have her lung function preserved for as long as possible at as high as level as possible. My understanding is that once folks are transplanted, only about 50% of them are still alive after the 5-year mark. So I hope that through early diagnosis, she can hang on to her original lungs for as long as possible, and we can just keep the transplant option on the back burner until we absolutely need it.
Do I think that newborn screening positively impacts patients? I would be a little bit biased in my opinion of this, but absolutely. I think that it can cause some anxiety and fear and emotion early on in parents. Unfortunately, that's kind of the bad part about newborn screening, is that you're screening for things that you're not even aware may be an issue. But I think the good really outweighs the bad. I think there's so much that we can do ahead of time to prevent as much as possible long-term issues, to get them started on treatment and therapy even before they start to develop symptoms, that you're really giving them the best chance possible at a long life, a good quality of life too. And so the research has shown that even if we start patients with cystic fibrosis on therapies and medications early on, and not just wait until they start developing symptoms, that it really does change the course of their life. And so I strongly recommend the cystic fibrosis being on newborn screening. I think it's a delicate situation because you're dealing with newborn babies and new parents, and that's why I love my role as kind of being a part of this, to piece together all the moving parts and to kind of sit down and gently explain to parents what really is going on and what this means, or maybe even what it doesn't mean. But I think it's a very important thing, access to healthcare that we have currently, to be able to do this so early on in life.
I think it might in some ways be harder to have the diagnosis as a newborn. The kids who were diagnosed a little bit older, their parents knew there was a problem and have been fighting, trying to find out an answer to the problem. And it's really validating to know, thank God, somebody finally found something wrong. I mean, it's still devastating no matter who you are, but it's almost more devastating when you're floating along thinking, look at my healthy baby, they're doing so well. And then to get this news that, just kidding, your baby's not as healthy as you thought they were. And they've got this life sentence of treatments ahead of them.
I think that newborn screening truly affects the longevity of a patient who is diagnosed in the beginning, as we're able to give them medications right from the start, before any symptoms happen, before any damage has really started to take place in their bodies. We're able to give them life-changing medication before there's even any clinical manifestation of the disease. So we're helping children before long-term damage has really started, and we feel like that's it's a beautiful thing. That's a wonderful thing to be able to offer to families and children. Newborn screening has most definitely positively affected our ability to treat those children with cystic fibrosis. We are diagnosing them oftentimes prior to almost any real symptoms of the disease, and it allows us to affect change and to really treat problems before they even manifest themselves. So we feel like in many ways that the newborn screening process and identifying infants before they have problems is truly changing the face of cystic fibrosis. It is changing what CF really will look like in a lot of children. This is very exciting, particularly with the newer medications that are coming for cystic fibrosis, but to be able to identify an infant and intervene for them and give them medications that will help them allows them to live a much fuller, much healthier life, for sure.